Hi, my name is Hannah, and I'll be talking about the Summer of the Client. Sierra is a 4-year-old girl diagnosed with ASD at the age of 2.5. She currently receives 20 hours of ABA therapy and 2 hours of speech therapy per week. In her diagnosis, it displays that she has delays in language, social, and cognitive skills and shows some behavioral concerns. Her language skills look like her communicating using one or two phrases and displays struggles with complex communication such as responding to questions in details or using full sentences. Her social skills looks like her playing independently on her own and rarely showing any interest with her peers, socializing, or even initiating or interacting with her peers. She often engages in repetitive behaviors and has difficulty initiating or responding to social skills. Her cognitive skills, Sarah demonstrates that she can tact and match items. However, she struggles with more of the abstract concepts such as categorizing or putting things in sequence. Behavioral concerns is that when Sarah's routine is disturbed or is unable to communicate her needs, she engages in tantrums, which look like property destructions, crying, and SIB.
The VB Map is an assessment tool designed to measure the language and social skills of children with autism or other developmental disabilities. The VB Map utilizes the milestones assessment in which skills such as requesting, labeling things, and having simple conversations are assessed based on typically developing children. It also focuses on listener responses like whether Sarah can follow instructions and have social interactions, which are essential for her overall development. The barriers assessment is designed to identify and assess specific challenges or obstacles that may be interfering with your child's learning or progress. The transition assessment is designed to evaluate your child's readiness for transitioning from a more restrictive, specialized environment to a less restrictive educational environment.
The PEAK assessment is an assessment for kids with ASD that's based in ABA. It stands for Promoting the Emergence of Advanced Knowledge. The assessment style uses a combination of things such as structured tasks, observation, and then there's also a caregiver interview. The target age is primarily for 2 to 18 years old, but however, it can be adapted and for older people, and also the assessment can continue to be used for the same kid throughout their life into adulthood. The PEAK assessment looks at verbal behavior, cognitive development, social skills, and academic and daily living skills. The components, there are three. There's PEAK Direct, which is a direct observation-based assessment for evaluating the child's abilities. So this is like evaluating language skills, cognitive skills, receptive and expressive communication, foundational areas such as tacting, manding, intraverbals. Then there's peak relational training system, which assesses like a child's ability to understand complex relationships, cognitive skills, advanced learning such as concept formation, categorization, relational responding. And then there's peak transformation or peak generalization, which focuses on the child's ability to apply learned skills in different areas with different people, and it assesses advanced cognitive skills like problem solving, abstract reasoning. It helps determine whether a skill is truly mastered or requires further practice.
For Sarah, the VB Map is a great fit because of its focus on communication skills and verbal behavior, which are a key area of need for her. The milestones assessment will help us pinpoint exactly where Sarah is with things like responding to questions, play skills, and sequences. This will then allow us to set achievable goals for her. The VB Map is designed to track progress over time, helping us see how Sarah is improving in her communication and when it's time to move on to more advanced skills. This helps to ensure that her therapy is individualized to her needs and that we continue to work on building functional skills. The barriers assessment will help us to identify any obstacles that are impacting her progress and develop interventions to better support her learning. The transition assessment will help us determine if Sarah has acquired the necessary skills through treatment to succeed in a school setting, which would be the ultimate goal for her.
Hi, I'm Jeremiah Ross, and I'll be discussing the assessment timeline. For the VB map, there is no set amount of time it takes to complete, but practitioners have reported that using the VB map manual allows for the milestones component to be completed in 2 to 4 hours, depending on the learner's skills. There's also a barriers component that is highly recommended. The barriers assessment will help to determine behaviors that could interfere with skill development. An adequate barriers assessment could take another 2 to 4 hours. All in all, the assessment should take between 4 and 8 hours to complete. The VB map will assess 170 skills across 16 developmental areas. Some of these include communication, imitation, play skills, independent skills, and academic skills. The results will assist in determining a developmental age and give the practitioners a starting point for the behavior intervention. Another important conclusion will be the identification of barriers that are impacting developmental progress. Some barriers include problem behaviors, prompt dependency, or self-stimulation. Once the learner makes progress, a transition assessment can be conducted to determine their school readiness. Lastly, we will use the results to develop an individualized teaching and behavior plan to overcome barriers and promote efficient learning. The teaching procedures will be reinforcement-based and least restrictive to promote the learner's achievement and enhance their well-being.